Hello, this is Shar-Day Ali, and I am going to be delving into the presentation, The Impact of Stress on the Human Body. So today I will be discussing the impact of stress on the human body with a particular focus on chronic stress and its relevance to social work practice. Stress is something all individuals experience, but prolonged or unmanaged stress can significantly affect physical health, mental well-being, and social functioning. This presentation draws on biological research and social work perspectives to explain how stress affects the brain and body, how chronic stress differs from moderate stress, and how social workers can apply this knowledge in practice to support clients experiencing long-term stress. Understanding stress overall. What stress is and why it matters. Stress is the body's natural response to perceived demands or threats and involves both biological and psychological processes. According to Matter and Wenzel, that stress activates interconnected systems in the brain, nervous system, and endocrine system that prepare the body for action. While this response is adaptive in short-term situations, ongoing stress without adequate recovery can become harmful. For social workers, understanding stress is critical because many clients live in environments where stress is constant, making it a key factor in health disparities and mental health concerns. There are so many different types of stress. Some of the main different types of stress are they're kind of curated in three main categories, which would be acute stress, chronic stress, and eustress. Stress exists on a spectrum and is not always harmful. Acute stress is a short term and can help individuals respond effectively to challenges. Eustress is a positive form of stress that promotes motivation, growth, and learning, such as starting a new job or pursuing an education. Chronic stress, however, occurs when stressors persist over time without relief. Research shows chronic stress places the greatest burden on the body, increasing the risk of anxiety, depression, cardiovascular disease, and immune dysfunction. Breaking down the biological stress response. So, how the body responds to threats. When the brain perceives a threat, the amygdala sends signals to the hypothalamus, activating sympathetic nervous system. This triggers the adrenal glands to release adrenaline, and cortisol, increasing heart rate, blood pressure, and energy availability. This fight or flight response allows the body to react quickly in dangerous situations. However, when this response is activated repeatedly, it places excessive stress on bodily systems, contributing to long-term health problems. Effects of chronic stress on the brain. Neurological consequences are at bay. Chronic stress has measurable effects on brain structure and function. Prolonged exposure to cortisol can reduce hippocampal volume, which affects memory and learning, while increasing amygdala reactivity, leading to heightened fear and anxiety responses. These neurological changes help explain why individuals experiencing long-term stress may struggle with emotional regulation, concentration, and decision making. For social workers, recognizing these biological effects prevents mislabeling stress responses as personal failures. Chronic stress versus moderate stress. Why recovery matters. Moderate time, moderate time limited stress can build resilience when individuals have opportunities for rest and recovery. Ellis Note that stress becomes harmful when it overwhelms coping systems and lacks proactive supports. Chronic stress differs because the body remains in a heightened state of alert without returning to baseline. This ongoing activation disrupts normal functioning and increases vulnerability to illness. The key dysfunction is not stress itself, whether but whether the individual has safety, support, and recovery time. Personal experience of stress. So, biological, emotional, and social effects. During periods of sustained academic and professional stress, I experience physical symptoms such as chronic fatigue, muscle tension, disrupted sleep, and difficulty concentrating. Emotionally, this manifested as anxiety and increased self-criticism. Socially, I noticed withdrawal from supportive relationships due to exhaustion and overwhelm. From a clinical perspective, this reflects prolonged activation of the stress response system affecting both physiological functioning and physiological regulation. Physiological regulation and psychological functioning, my apologies, consistent with research on chronic stress exposure. Psychological effects of stress. Chronic stress significantly affects psychological well-being. Individuals may experience anxiety, depression, irritability, and negative self-beliefs. Burns explained that prolonged stress interferes with emotional regulation and reduces coping capacity. Over time, these patterns can reinforce avoidance behaviors. Hopelessness and social isolation are key factors. Understanding stress-related mental health symptoms as adaptive responses rather than weaknesses is essential for ethical and effective social work practice. Social effects of stress, relationships and support systems. Stress does not occur in isolation and often disrupts social functioning. Chronic stress can strain relationships, reduce communication, and limit access to social support. Ellis emphasized that resilience is strengthened through stable, supportive relationships. When stress leads to withdrawal, individuals lose key protective factors. Social workers must assess not only individual symptoms, but also the client's social environment and access to meaningful support systems. Micro-level social work interventions. Applying research to practice is important. At the micro level, social workers can help clients regulate stress through mindfulness, grounding techniques, and cognitive behavioral strategies. These interventions support nervous system regulation and help interrupt automatic stress responses, according to Burns. Teaching clients to recognize bodily cues, challenge stress-related thoughts, and build coping skills empowers them to regain a sense of control and stability in their daily lives. Coping strategies for chronic stress. Supporting long-term regulation is a really big factor as well. Effective coping strategies include regular physical activity, consistent sleep routines, balanced nutrition, and intentional social connection. These behaviors help lower cortisol levels and support nervous system recovery, according to Matter and Wenzel Speck. Social workers can collaborate with clients to develop realistic routines that fit their circumstances, recognizing that small, sustainable changes are often more effective than drastic interventions. Implications for social work practice. Understanding stress through a biophysiosocial lens also allows social workers to assess biological vulnerability, psychological responses, and environmental stressors simultaneously. Ellis highlight the importance of resilience, focused interventions that strengthen protective factors rather than solely reducing risk. This approach aligns with ethical trauma, informs social work practice, and supports clients in building long-term well-being despite chronic stressors. Here are my references that I used according to this presentation, this PowerPoint presentation. Thank you so much for your time and your attention to this presentation. Thank you so much. Bye.